Ever heard the myth that impacted teeth are a result of not brushing enough? Well, it's time to bust that myth and dive into the real causes. Impacted teeth are not an enigma, nor a result of poor oral hygiene. They are simply teeth that have not emerged fully into their expected position. Now, why does this happen? There are several reasons. One common culprit is a lack of space. If your jaw doesn't have enough room to accommodate all of your teeth, some may become impacted. Another common cause is the wrong angle of growth. If a tooth grows at an incorrect angle, it may become trapped or impacted against another tooth. It's important to remember that impacted teeth can occur in anyone, regardless of how meticulous they are about brushing and flossing. Now that we've cleared up some common myths, let's move on to how dentists manage impacted teeth. If you or someone you know has impacted teeth, you might be wondering what the next steps are. The answer often lies in surgical management. Let's break down what that means. First, a dentist or oral surgeon will assess the situation. This typically involves a comprehensive oral examination and X-rays to get a detailed view of the teeth and surrounding structures. They'll look at the position of the impacted tooth, its relation to surrounding teeth and nerves, and the health of the overlying gums. Next, they'll discuss anesthesia options with the patient. This could be local anesthesia, where only the area around the impacted tooth is numbed. Or it could be general anesthesia, where the patient is put to sleep for the duration of the procedure. The choice of anesthesia often depends on the complexity of the case and the comfort of the patient. Once everything is set, the actual procedure begins. The surgeon will make a small incision in the gum to expose the impacted tooth. If the tooth is still embedded in the bone, a little bit of the bone covering the tooth may also need to be removed. The tooth is then extracted, sometimes in pieces if it's easier that way. After the tooth extraction, the area is thoroughly cleaned and stitched up. A gauze pad is placed over the surgical site to help control bleeding and aid in clot formation. And that's it, the surgery is done. But the patient's journey doesn't end here. Post-surgery care is crucial for proper healing and recovery. This might involve taking prescribed painkillers, applying ice packs to reduce swelling, and eating soft foods for a few days. It's also important to maintain good oral hygiene, but without disturbing the surgical site. After a week or two, the patient will return for a follow-up visit. The dentist or oral surgeon will check the healing process, remove any stitches if necessary, and address any concerns the patient might have. So, although it might sound daunting, the surgical management of impacted teeth is a well-practiced procedure that can alleviate pain and prevent further complications. You've made it this far and you're now more informed about impacted teeth and their surgical management. But what should you remember most? First off, never underestimate the importance of a professional assessment. Your dentist not only identifies the impacted teeth, but also devises the most effective treatment plan tailored to your needs. Next, anesthesia plays a crucial role. It ensures that you are comfortable and pain-free during the procedure. Whether local or general, the type of anesthesia used depends on the complexity of your case and your comfort level. Then, we have post-surgery care. This is vital for a smooth recovery and avoiding complications. Follow your dentist's instructions, whether it's about medication, diet, or rest. Remember, while the word surgery can sound intimidating, it's a regular procedure performed by dental professionals who have your best interest at heart. With this knowledge, you can now be more confident in discussing impacted teeth and their management. Keep smiling and remember, knowledge is the first step towards a healthy mouth.